Lights out.
Welcome everybody once again to another fantastic episode of SleepTech Talk, the sleep podcast for all your folks out there that are in sleep technology, sleep medicine, with your hosts, Emerson Kerr, Robert Miller, and me, without a complex. We were talking about K-complexes a while ago, but Jerry George Money Carote. And we have a fantastic guest once again this week. But before I go any further, hey, Robert, will you tell us a little bit about what's going on the show today?
Hey, we have a special guest with us today, Dr. Gregg Marshall. He is going to join us, and we're excited to hear about his journey as a sleep professional and all the things that he's been involved in and is currently involved in. And you know, I think we'll probably end up trying to wrap it up with, you know, where he thinks the future of sleep medicine might take us. But we're excited for everyone to join us today. We thank you so much for the support, and just keep listening. And also don't forget to send us ideas about you know, things that you want to hear about and topics that might be important to you. So Greg, we'll turn it over to you, and we appreciate you being here today.
Great. Thank you so much, guys. It's a real honor to be with you. Passionate about sleep, passionate about respiratory care. I am dually credentialed in both. And, you know, we found out a long time ago it was a good thing to breathe through the night. You know, oxygen is an amazing thing to permeate our brain in the night. I tell students all the time, you know, you got to get to REM to get that memory, you know, and they start realizing they have a responsibility to get a good night's sleep. Just a little background on myself. I'm old. And I graduated with a bachelor's degree from Baylor. I have a master's degree from Texas State University, and I have a PhD from UT Austin. So I'm an I-35 guy. You can just go up and down 35, and that's where I got my education in Texas. That's a great thing.
Hey, at least you finished right at UT, so hook 'em.
There you go. It's exactly right. I have taught at Texas State University as a respiratory therapist, oh my gosh, for 42 years. And about 2003, I became chair of the Department of Respiratory Care. I'm still chair. And one of the things that we did is I took leadership. We began to look around to see what the future was for respiratory care. And we saw that there was momentum in the sleep world that was connected to respiratory care. I didn't understand how the sleep profession was pulled apart in kind of like three different groups. You know, there was the respiratory side that says sleep belongs to us. There was the EEG, PSG side that said it belongs to us, you know, and then the neural was in there. So it's been a tug of war for the discipline, I think. But we wanted to see what we could do to contribute to the growth of sleep from the respiratory side of things. So we began to look around and realize that there was a shortage of education opportunities for folks to be trained in sleep. And we did not have a sleep lab. We were, Texas State University is located in San Marcos. At that time, that's where we were. And we began to think, what can we do? Well, we would love to take a look at developing a curriculum. There was very little guidance back then. I did send 2 faculty to the Atlanta School of Sleep, and they endured those 10-hour days of that, you know, 4 or 5 days with, you know, they said we were in the room with physicians and sleep techs. We were all together. We were learning everything together. They came home, and I threatened them if they didn't pass their board exams, and they passed the first time. So that was great. And I couldn't afford to send myself, so I got their notes and studied, and I went and took my boards, and I passed them. So I can appreciate all the hard work that goes into studying for those exams, that's for sure. But it wasn't quite the level of torture that some people have had that had to do several parts. So everything was online. That was when it was first moved to online. And so we started out with 3 of us that were dually credentialed in sleep and in respiratory. And we felt like that would give us the start that we needed. We could kind of legitimate ourselves as being faculty members with administration saying, look, we're credentialed in both. And so we would like to develop the polysci side of this. Kind of simultaneously at the same time, and Dr. Jerry will remember this, Phillips kindly reached out to us and several different other sleep techs and said, what can we do to help to develop a sleep society in Texas? And we were very excited about that. We had some real exciting meetings that have some tremendous history. We'll have to tell you about it at a conference sometimes over a cup of coffee. But it was very exciting to see the development of the Texas Sleep Society for sleep professionals. TSIP is what we ended up calling it, TXSSP. And as we started out, we had, I was able to serve as vice president for 2 terms because we had to get things going. We had our first conference, sleep conference with TSSP in San Marcos at Texas State University. I was able to get the ballroom for free. It set 500 people and we had a really good attendance. And people were very excited to think, wow, we're building a community. We're getting connected. We want to see where we are and what it takes to get momentum. About that time, as we were developing the curriculum, I went to administration. I said, the best way that we can teach them is to have our own sleep lab. And so was able to get square footage in an area that could be remodeled from them, but no money for equipment. So I'm poor, but I'm a state employee. I know how to beg. And so I began to call around and explain what our role was. We want to put in a 2-bedroom sleep lab that will train and educate respiratory people to cross over and to bring in people that we can train and do some sleep research. Would you be interested in a gift in kind that's tax deductible to the state of Texas? And we were able to bring in about $170,000 worth of equipment, gift in kind, no cash, but it fully furnished 2 bedrooms with great polysci equipment. We had everything that we needed to start in. We opened our doors. The next thing we did, like many of you that have worked in standalone labs, and at that time there was no accreditation that was required, we began to see that accreditation was important. And so we underwent 2 rounds of the AASM accreditation and reappointment to accreditation, and that went well. And then we just educated physicians in our area, because San Marcos is a little sleepy little town south of Austin, kind of in the Wimberley. There's a lot of retired folks. So it had the right kinds of people that would need to have sleep studies. And we educated the physicians around there of the need through marketing, and really began to develop a great reputation there in that little area. When we left San Marcos, and the reason we did was because the university has a north campus in Round Rock, and they built a brand new building for us, and I got to design that sleep lab, and it's a 4-bedroom. And as we left, there were about 150 physicians that were crying and complaining that we were leaving, but we had about an 85% occupation rate, which was really strong. And we really enjoyed that leg of our journey for sure. As we developed a curriculum, we got the idea, because you know how academicians are, they kind of think on the edge of things. We were putting together this curriculum, and I asked my faculty, well, what's keeping us from offering this at the graduate level? And they said, well, so we thought, well, we'll offer it as a certificate program, both at the bachelor's level and at the graduate level. And our administration went for that. And so that's really what kicked us off for that. We found out that we didn't have hardly anybody that was applying for the undergraduate certificate. Everyone wanted the graduate level courses. So if they had a bachelor's degree or near to a master's degree completion, they could take these 18 hours of upper level division courses, and we taught right there in the lab. We had classes right there. The clinicals were great because I hired 2 sleep techs that had great experience, and I wrote into their contracts that they were clinical teachers as well. And so they welcomed the students, wouldn't allow them to be grumpy and grouchy with them. And the students really enjoyed that opportunity there. And so that was really our involvement in kind of bringing sleep in.
Let me ask you a quick question, because you've got a rich history when, in developing the school, and especially looking at where it was then to where it is now. What do you feel like are some of the bigger changes that you are experiencing? Because clearly sleep technology is changing a lot more than it ever has. When you compare and contrast, what do you feel like has been the biggest change in how you teach and even in the students that you're seeing right now?
Well, that's a great question. Thank you. Our graduate PolySom certificate program kind of morphed into the beginning of a master's in science in respiratory care with a track in PolySom. And so that's where we are today, is we were able to, because we had kicked that door open with the graduate certificate in sleep, administration said, well, sure, you have interest and let's go ahead and move forward. The respiratory profession was moving towards a master's in respiratory care as well. So we were so dedicated to sleep, we said, well, we'll have a leadership track, our major, and then we'll have a PolySom track, our major. And then so many of our students that went the leadership track said, well, we don't want to not have the PolySom. Can you make it a minor? And so we came back and we actually added a minor to the leadership track of the master's program so that those students that were getting their major in leadership could also minor in PolySom. They ended up taking every course in the whole curriculum and were able to sit for board exams. So what we're seeing now, I guess, go ahead.
Let me jump in and ask you a question. The students who've gone through your master's program and may have a secondary degree in PolySom, what have they been able to do with those advanced degrees? I think it'd be great for our audience to hear, what the opportunities are as they advance their education, maybe get their CCSH, that sort of thing.
So I think the MSRC, the Masters in Science and Respiratory Care, we're looking towards the future in several things. Research. So we need advanced understanding of research. So they take 3 research courses in that master's because we want them to be able to not only read research, but to be able to construct a research project and be part of that. We're looking at growing faculty, and in all programs you need now that are SACS accredited, especially in the South, you have to have 18 hours of graduate studies in the area that you teach in. So for a university or a college to have a PolySom, even bachelor's program, for example, they would need to have master's hours in that. So we're seeing that happen. The other thing is that we really wanted to happen was to I guess, impart a passion for sleep to these rising leaders in respiratory care so that they would make that part of their world. Now, people with the leadership, MSRC, they end up being doors kick open for them to be advanced supervisors and assistant directors and directors. And so what we hope is that their education in sleep would encourage them, if their hospital didn't already have a sleep component, that they would want to reach out and to do that. So we're kind of, I guess, clandestinely trying to plant in them this passion for this, what I consider a sister discipline to respiratory, so that we can be, part of advancing that with faculty and research as well.
So Greg, this is extremely interesting, and we're getting short on time, but especially the fact that I'll tell you, for me, and I can say that for a lot of sleep techs that I've met, that whole concept of research is just not there at all, unless they're working for a teaching institution, like you said. But to simply be a researcher, that's a great place to think about. But, and you also talked about these other avenues that somebody with all this education can do. But the other side of it is like what Emerson said, you've seen a lot of changes. I got to see you early on when you were trying to bring education to us techs and sleep techs, and I still remember some of those old ones that we did back in the day. Where do you see the future of sleep technology going from here?
Well, you know, I guess to answer it, where we are now in Round Rock with our 4-bedroom lab, what we ended up doing was, instead of being a standalone lab, we affiliated ourselves with Ascension, Seton, Williamson, which is our next door neighbor. They're literally 500 yards from our back door to their back door. And their sleep docs have decided that what they need to do to meet the need, because, you know, we all know this, physicians order sleep studies because they know something needs to be done. But if it's a primary care physician, they don't know what to order, and they don't know what to do with the results. And so our medical director, who's board certified in sleep as well as pulmonary and critical care, with his group, have started 2 weeks ago, so it's brand new, a virtual sleep clinic. And so they're seeing the patients when the primary care physician orders it, they're seeing them virtually, they're assessing them. If it's an HST requirement, that's being taken care of. They come in and have their sleep study that the pulmonary doc for the virtual visit has written a script for. They come back after the results are interpreted for a follow-up visit, and then they're directed to DME if that's needed. And then there's follow-up visits that come after that. And so what we're seeing is that the docs that are out there, they know that their patients have a sleep problem. They don't know where to go. They don't know how to access. And so this is our attempt to open this door for access for physicians, because now the dentist, you know, the American Dental Association has said, when you get your patient in the dental chair, assess them for sleep disorder. So we have dentists that are coming to us and saying, we know we can't script in anybody for a sleep study, but what can we do? Well, we said, here, you refer them to the sleep doc and let them come in for a virtual visit, and we'll take them through our pathway and get them qualified, get their insurance verified, all those things taken care of. And so we're seeing sleep docs taking a look at what the dentist's needs are, of course the ENT, of course the cardiovascular surgeons, pre-surgical homes. We're seeing a huge need there, because if patients are assessed to have sleep needs, they won't do a thoracotomy, they won't do the bypass, they won't do the abdominal surgery until they have a sleep study. So we're getting referrals in from the pre-surgical homes, and it's really amazing to see how this group is coming together. Our medical director is pulling together all these different backgrounds of physicians and having like a rounds every 2 weeks where they talk about the patients and talk about what the needs are and what they can do to help people have a study that need a study. It's a big job, but we're excited to be part of it.
That's extremely impressive. I remember when I started my lab, I shouldn't say my lab, but the lab that I started many years ago, we did do that multidisciplinary approach. And I really like the way that you're rounding it out, including these multiple facets. But we're really close to time. So want to ask you, is there anything else you want to mention, or any words of advice to those that are listening or even watching us here today?
I think one of the most important things that a sleep tech could be doing is to really challenge themselves for more education. We do that, of course, through CEUs, and that's a great way to be involved. But to, like you said, not be afraid of a research opportunity, and even begin to talk to those that are in their company to see, is there something that we can do with research? Can we reach out to pharmaceutical companies that want to bring patients in to do some sleep research? How can we be part of something that's ongoing? And reaching out to physicians as well to see, especially sleep docs, to see what could we do to be a part. I think that brings a level of respect, research does, to those that interact with us profession, whether you're a respiratory therapist or you're sleep. When you can hand a doc an article that is talking about a new innovative way to deal with a sleep problem and say, read this and tell me what you think, and then just turn and walk away. I can guarantee you that doc is going to fold it and put it in his pocket, and later on he's going to pull it out and read it. And even if he doesn't agree with the research, he's going to remember that SleepTech has an interest in the profession and in sleep medicine to the point of reading research, and they'll be back to have a conversation.
That's awesome. That's awesome. Thank you. And if anybody wants to get in touch with you, where could they connect with you, Doc?
Sure. They can, my email address is docg, D-O-C-G, at txstate.edu. That would be the easiest way to access me, is shoot me an email. And if there's anything that we can do, anything that we can share, we'd love for people to duplicate what we're doing and take it to the next level. That'd be awesome. So we're just, we're in it to see people breathing in the day, breathing at night.
Oh, that's awesome. Thank you. Thanks, Doc. I appreciate it. And for those of you who may not know, Doc's a friend of mine as well, and we've known each other for several years. And like you said, there have been some interesting conferences, and Robert Emerson will talk about that. He said over a cup of coffee, maybe something stronger is required for that. But
Great.
With that being said, we're going to close for today. Doc, thank you so much. This was so interesting. Really opened up my mind, I'm sure, for the others and all those that are listening and watching. And with that being said, all of you out there, our supporters, our listeners, our viewers, we thank you so much. We can't do this without you. And with that, see you next time. Lights on.